Hi, I'm Melissa, and I read Fresh Fruit, Broken Bodies, Migrant Farm Workers of the United States by Seth Holmes. So, a summary of it is Holmes, he's a medical anthropologist and a physician, and he did immersive field work with the Triqui people, and they're an indigenous group from Mexico, and how they faced absolute extreme economic hardship by migrating over here. And they, being indigenous to that area, speak a different type of Spanish than what most people from Mexico speak. So that makes them even more unique than what I think of, what I ever thought of from migrant workers. So they endure discrimination, obviously racial discrimination, really horrible living conditions, heat, cold, inadequate shelter, and then lack of legal protections if there is any legal protections for them. If anything, they're legally exploited. So high physical demand, they're breaking their bodies down so very fast. It's really hard work, and then horrible pay, low pay, like $20 a week pay. So this book goes over structural violence, and structural violence is a social, political, economic system that harm individuals by preventing them from meeting their basic needs. So, they are exploiting these people with the work, barely giving them wage that they can afford basic necessities with, much less healthcare, with really harsh working conditions that lead to chronic pain, bad nutrition, because how are you affording groceries, and lack of medical care, because how are you going to afford your medical care or even get to it transportation wise? So, like I said, exposure to extreme weather, stress injuries, and dangerous pesticides. Language barriers, like I said, they speak a different type of Spanish, so even like our normal interpreter lines may not work for them. And then they're scared of being deported, so they probably avoid medical care most of the time. Applying this to nursing practice, understanding their backgrounds and their struggles and what they're going through, I thought that I understood migrant worker background fairly well because I've dealt with them before, especially with horses. There's a lot of migrant workers that clean stalls and help around ranches, and this was even more than I even realized. So, being able to understand that and use that for your practice, mobile clinics obviously would help them because how are they getting transportation to a medical clinic? And outreach programs so that it's being funded because how are they going to pay for it? Would help bridge that healthcare gap. And then also going to them probably helps make them feel more at ease that they're not going to necessarily be, deported and take away, helps take away some of that fear for them. Education on safety, trying to be able to teach them good habits, preventative care so that they don't get injured, try and make them last longer so that they can work longer, so that they aren't then disabled on top of what they already go through here. And obviously, advocating for policy changes would help us reach the systemic level and not help just a few people, would help everybody. For new nurses, I think that just the empathy and awareness that this gives you is really important. Like I said, I thought I knew how to handle at least a little bit of what they go through, and I just didn't. Um, Preconceived notions about undocumented workers, just helps take some of um, the racial inequality that we have that goes with it. Uh, and then us advocating for policy reform is going to help, protect these people. And it really highlights how social determinants of health, you know, work on their outcomes. And if we could help them with that, they would have better outcomes than what they have been having. For veteran nurses, it just gives you insights to the barriers that they face and how these issues are affecting their health, gives you a deeper understanding. Like I said, policy reform would really help on a systemic level, and it would help with workplace improvements if you could get some policy reforms. If we did something about it and we said this is not okay, people would have to start changing. And it strengthens, obviously, our cultural sensitivity and trauma care approach. You know, these people are experiencing certain types of trauma, something that would be absolutely traumatic to us. And to them, it's just kind of their norm. This is just how they live, and being able to understand that for them. Surprises was the really vivid descriptions in the border crossings and the farm labor. Like I said, Holmes went with them. At one point, he actually got imprisoned, and the people that he was with got deported back, and the conditions that they're trying to cross in as well. And then the conditions that they're working in, that they're living in whenever they're working on the farm it was just very descriptive. More research into the pesticide exposure and labor laws for undocumented workers. You know, pesticides are linked to neurological issues, reproductive, and cancer issues. And if there's any legal protections, they're inadequate, and most likely there isn't legal protections. And these people are so scared of being deported, and they don't have the money to be able to hire anybody for that. A lot of these workers just accept pain and illness as a normal part of life. Like that just is what it is for them. What are you going to do about it? How would we make it better? They don't understand that it's not necessary, and they don't understand a life without it. Memorable moments for me, like I said, the author's willingness to live and work alongside them. He went right alongside them, but even though he was right alongside them, he's a white middle class male, and he was still treated differently. He was still treated with more respect than they were, and he was able to, describe that as well. The physical and emotional toll that these people are going through is really heartbreaking, and then just the resilience of these people, and their it's really inspiring, that they're living in these conditions and they're accepting it, and they're still just trying to make a better life for themselves no matter what. So, obviously it's frustrating, and very sad, and that's the impacts that it had on me. And it reinforces that advocating for these patients is really important. And I'm not huge on advocating for policy changes. I'm not huge like a policy person. That's just not me. I'm not a huge political person, so that's something that reminds me that I should start paying more attention to, and being more vocal about, and just kind of deepen my commitment for that, so that they can have more equitable health care. Questions that it left me with is what more can be done at a policy level to improve healthcare access for these migrant farm workers? Can we get mobile clinics? What kind of funding can we get for them? How can we protect them? How can, you know, we make things so that they can have a good life as well? How can we play a more active role in addressing their disparities? And what are the long-term impacts of these working conditions on future generations? Because this is going to continue on for generations to come if nobody does anything about it. There's my reference for the book. I really suggest that you read it. I could talk on and on. This is my second recording. My other one was way too long because I had a lot more to add, but it's a really good book. I'm really glad I read it, and I really think that everybody else should as well. So if you have any questions, I'm happy to talk about it more in our discussions that we're going to have. So everyone have a good day.